It seems to me in our practice that we are diagnosing a lot more Cushing's. And I want to know whether there is an increase in the disease prevalence itself or just that we're catching it a lot more.
I think it's a great question. I think the answer is yes to both. Most of the data now coming out is showing that the incidence of Cushing's is about 90 to 100,000 new cases per year. Some of it's clearly because veterinarians are just running more tests. They're picking the disease up earlier. But I think a lot of it has to do that the dog population is just getting older. And since it's a geriatric onset disease, the dogs are living long enough to start to manifest signs of Cushing's.
Is there any thoughts as to the cause?
There's a lot of work being done on cause of pituitary tumors, both in people and in dogs. And with respect to Cushing's, in humans, there's a lot of known genetic defects that occur in the pituitary that result in the disease. We haven't found any of those mutations in dogs. And so the theory now is that in humans, it's primarily a pituitary disorder. In dogs, it's primarily a disease of higher centers in the brain that regulate the pituitary. So it's more of a neurodegenerative disease of older dogs that causes hyperactivity of the pituitary.
Has there been any studies comparing the incidence of Cushing's disease in our spayed and neutered population versus our intact population?
Yeah, it has been looked at. I mean, unlike the problem that we see in ferrets with adrenal disease that are spayed or neutered, we really haven't seen any difference in the frequency of Cushing's among spayed or neutered dogs.
I've been reading some literature on trilostane, and there's some literature out there about how after 2 years of treatment, the dosages that are needed may go down for certain patients. And so we're starting to test ACTH, stim test these dogs every 6 months versus once a year. And I'm just wondering if you can speak into that as far as advising the small animal practitioner on that.
Well, I think there's a couple things. One, I think since the launch and since more veterinarians have been using Veteril or trilostane to treat Cushing's, we've noticed that the initial starting dose that we recommend now has come down quite a bit. So rather than the labeled use or the early use where we're giving maybe 4 to 6 milligrams per kilogram, now we're only giving 1 to 2. And I think part of that's related to what you observed, and that is over time, as they continue to take an adrenal enzyme blocker, it seems like they develop a cumulative effect, and the dose does go down. So, and I also agree that more frequent monitoring probably makes sense. We usually recommend that they come in every 3 to 4 months.
You talked a little bit about some new treatments that might be coming. Can you expand on that a little bit?
Yeah, I think both on the human side as well as on the veterinary side, we're really trying to move towards pituitary-directed therapy. So whether it's surgical or radiation, but from a medical standpoint, we're learning a lot about different receptors that are abnormal or overly expressed in the pituitaries of dogs that have Cushing's. And so the primary interest right now is looking at the somatostatin receptor and drugs that block that, and the dopamine receptor and drugs that block that. So recently in people, 2 new drugs have been approved, and we're hoping to be able to start to use those drugs in dogs.